My name is Renate Kahlke, and I'm a scientist here at Merit and assistant professor at the Division of Education and Innovation in the Department of Medicine at McMaster University. I hold a PhD in educational policy studies from the University of Alberta, where I trained in a variety of qualitative methodologies that I use to tackle complex problems in health professions education. My interest in HPE stems from my work as a curriculum designer, a faculty developer in interprofessional education and simulation at the Health Sciences Education and Research Commons, also at the University of Alberta. In this role, I became interested in the problems of practice, moments when trainees and health professionals have all the knowledge they need, but struggle to act on that knowledge. In my own life, I've seen so many examples, ranging from moments when I've struggled to be an ally when I see other women harassed on the bus, or when I've struggled to implement new strategies that I know would improve my writing. These are problems where classic educational solutions fall short, since more content knowledge won't provide solutions to sociocultural and systemic challenges. So in this presentation, entitled When It's Hard to Do What's Right, I talk about what sociocultural theory is and what it can do to help explore these problems. Sociocultural theory is an approach that maps how people participate in their social systems. It allows me to appreciate the contextual barriers and affordances that impact our behavior. In this presentation, I use my recent study on learner health advocacy to illustrate what sociocultural analyses can do. In this study, we map the contextual factors that influence learners' decisions in moments where they identify a need for patient advocacy in their clinical learning and work. I think sociocultural theory is unique in its appreciation of human agency. Some learners find ways to advocate despite seemingly overwhelming barriers, while others in the same situation aren't able to exercise the same agency. Each person takes on unique roles and participates in their context slightly differently. But by identifying sociocultural barriers that undermine agency, we can begin to remove or manage these barriers at the same time that we bolster affordances that support learners in advocating with their patients. I hope that this presentation stimulates interest in sociocultural ways of thinking about context. Three key take-home points from this presentation for me would be, one, that there are many practice problems that can't be solved through traditional solutions in education, since more knowledge does not remove real social and systemic barriers that prevent individuals from implementing knowledge in practice. Two, sociocultural analyses can help map how social systems work, allowing us to make systems changes that appreciate the unique ways in which different individuals interact within their contexts. Sociocultural analyses, third, appreciate human agency. Individuals bring unique knowledge and beliefs that can help them make their own decisions about how they will participate in their contexts. I was asked to provide a few relevant resources for anyone who's interested in following up on these topics. First, I have a short When I Say paper. It's called When I Say Sociocultural Learning Theory in the journal Medical Education. It was published in 2019, and I thought it might be a helpful first primer on sociocultural theory. I also have a critical review in Advances in Health Sciences Education, which was published in 2020, called The Disconnect Between Knowing and Doing in Health Professions Education and Practice. That paper looks at how different psychological and sociological theories might inform our understanding of why people can struggle to implement knowledge in practice. Finally, I really like and wanted to recommend Lara Varpio's 2017 paper in Medical Education entitled Tackling Wicked Problems: How Theories of Agency Can Provide New Insights. That paper looks at a number of theoretical approaches to agency, including a sociocultural theory called activity theory.